Welcome, friends and colleagues, to today's installment in the Dart Center for Journalism and Trauma's ongoing series, Reporting and COVID-19, Conversations for Journalists. Note the particular construction of that title. It's not only reporting on COVID-19, but reporting amid this pandemic. We've been talking and are going to continue to talk for the coming weeks with a variety of news professionals, subject matter experts, others on all the different ways this pandemic is shaping our reporting and on enriching our toolkit and enriching our reporting at this crucial time. This week's installments, today and on Friday, will be focusing in particular on a critical underreported side of the coronavirus issue around the world, young children, the impact of the pandemic, the impact of social distancing on the youngest humans, on children in the first years of life, and on ways of covering this impact and covering some of the policy changes that are needed to support children at this time. I am really pleased to be joined today by my colleague and friend Cecilia Vaca Jones, who is the executive director of the Bernard van Leer Foundation, based in the Netherlands. Full disclosure, the Bernard van Leer Foundation funds an ongoing Dart Center series of programs, workshops on covering early childhood development. But she is also not just a funder, but one of the world's great experts on this issue. Cecilia has over 20 years of experience managing social development policies and programs. Before she came to the Bernard van Leer Foundation, she was the coordinating minister for social development in Ecuador, in the cabinet in Ecuador from 2013 to March 2016, responsible for policies in health, housing, sport, and social welfare. She is a longtime champion of the rights of children, the rights of women, the rights of vulnerable populations in general. And she brings a combination of policy expertise, scientific understanding, and political savvy to this conversation. We're really glad to have you here, Cecilia.
Good morning, Bruce. Yeah. And good morning, everyone.
The way this will work for any of you who are new to this conversation is that Cecilia and I will talk for about 20 minutes, kind of laying a foundation for discussing the issue. We'll then be taking questions, which we will take via the Zoom chat function. So whether it is in the course of our conversation or when we actually get to questions, just start throwing those questions into the Zoom chat and we'll sort of try to organize them, pull them out, and make the conversation coherent. This is a conversation focused on reporting and on journalism. So we'll try to be keeping questions kind of within that zone. And it is feeding an ongoing Dart Center tip sheet resource guide, other materials being compiled by my colleague Susan Kaplan, who is here as Radio Sue, veteran public radio reporter and past Dart Center Ochberg Fellow, who has her own expertise in reporting on highly vulnerable people. Cece, let me start it out this way. As coronavirus has exploded around the world, a lot of attention has, properly gone to the most visibly vulnerable populations, the very old, those working in crowded conditions, those living in extremely crowded conditions. And children, to the extent that they've been focused on at all in reporting, I think, we've tended to think of them as, well, they miss their friends living in socially distanced situations. They're missing daycare or school. On the other hand, they're getting all of this parental attention that they might not otherwise get. There hasn't been a whole lot of attention to the special challenges and significance of social distancing and pandemic for young children. What do you see as the reasons we as reporters should be paying attention? right now?
Well, thank you, Bruce, and good morning to everyone. Well, it's good morning for me. It's probably good afternoon for many of you as well. Uh, but yes, so I think it's great just being able to have this space to talk with journalists and people reporting not only on what's happening on COVID-19, but actually just like normally start reporting on what's happening around the world. And I think there's this huge gap of what has been happening to children. And of course, for us as Bernard and Leer Foundation, this is our main focus of work. So we've been quite concerned about what's happening to young children. Because if we think about when we first started with the whole pandemia and the effect that this had in elderly, of course, a lot of the attention was just centered on reporting on how the whole pandemia was unfolding and affecting adults and elderly people. But in reality, the pandemia is also affecting children and is affecting caregivers who are basically living this different ways of lockdown in every different city around the world. And I think that's when we need to start thinking about what's happening to children and what are some of the challenges that we need to start thinking about how children might be facing this pandemia. So I think there's something around the lockdown and how children and families are facing the lockdown and what are some of the health issues that we see besides the COVID-19 and how this can be affecting children. And then in general, I think that also reporting on some of these vulnerable families who have young children. And just to give you an example, I'm currently spending the lockdown in Ecuador, which is my home country. But I've been quite surprised to see what's happening with the Venezuelan migrants that we have at the moment. We have a pretty large population of Venezuelans, and it's quite impressive to see all these families that are trying to walk back to Venezuela, because basically what's happening to these families is that if we can think of any kind of vulnerability, these are the most vulnerable people because they basically don't have access to any kind of services. They cannot work. They need to stay indoors, but in most cases, they don't even have a safe place to stay. So what you see is these people are in constant move, but this doesn't mean that they are also in constant risk. Not only on COVID-19, but constant risk of many different ways.
From the research and what we know about the first years of life, what are the elements of pandemic isolation or of this kind of forced migration, of the loss of childcare and all the other things that are going on here? What are the things that would be most concerning to you? Maybe give us a little bit of foundation about what we need to be paying attention to in these first years of life that could have long-term consequences from this time.
So basically, and this is very important for everybody to know, in the first 2 years of life, you're basically supporting the foundations of the rest of your development. And just to give you like a clear example of what happens in your brain is, during the first 2 years of life, you can make up to 1 million connections per second. So this is how babies are basically developing the basis of their neurological connections. And what we got to make sure is that during this first 2 years of life, we can nurture babies in a way that we can make sure that these are healthy connections. But in order to have these healthy connections, we need to make sure that babies and families can access health services, which is the very basic, and this would be one of my main concerns at the moment. Are babies and families able to access health services? We know that in many of our countries, health systems are so stressed trying to respond to the COVID-19 that this might mean that they're neglecting other services that are very important, and especially at the beginning of life. And what I'm saying here is, if pregnant women are not able to do their maternity controls, this is putting babies at risk. If the very young babies and the newborn babies are not able to cover their vaccination schemes, this is also putting babies at risk. So there's one factor that's related to health, which is very important. But I think there's also a factor related to nutrition, which is also very important. So during the first 6 months of a baby's life, Of course, breastfeeding is the best way and the best kind of nutrition babies can have. But after the 6 months, babies need to start eating. And what might happen during the first years of life is if we have this pandemic scenario, many families might be struggling in accessing food. So making sure that families can access good food, and even for mothers who are breastfeeding, it's also like important that they can keep eating, because otherwise they stop producing milk. I think this is another big risk that I see. So nutrition and health, I would say, are the basic risks at the moment. But I would also say that there are other risks, because many of these vulnerable families are also in a very deep stress related to economic issues.
Mhm.
And this puts a lot of pressure on the way they can deliver like parenting, right? Because if a caregiver is not in a good state to just do the parenting, we cannot expect the baby to develop all these healthy connections that I was talking about. So for me, these are the three most important things that I believe it's important to consider, because I think that from a policy perspective, there are many things that we can do in order to improve these conditions that people need in order to improve the way that they can parent their children in the first years of life.
So if you were a local reporter, there are a lot of folks on this webinar who are local reporters, some of them perhaps in Quito or Mexico City, some in New York or Dallas, or rural communities in the US, some in Russia or in Africa. But if you were a local reporter trying to assess whether your community, or for that matter, whether your national government, was paying proper attention to the needs of young children right now, what are some of the benchmarks we should be looking at? Where should we begin our inquiries?
Yeah, I think there are different things that reporters should be looking at, right? Like first, from a policy perspective, I would be interested in reporting, are governments really giving any solutions for the most vulnerable households, right? And this is something that we usually are not seeing, because we're seeing the COVID-19 such a universal problem that we're not targeting how this is affecting in different ways to different people. So for me, it's very important that when you're reporting, you're also seeing, oh, which is the effect of this whole crisis in the most vulnerable populations. And then when I'm seeing the vulnerable populations, I got to see how is the government, or either the national governments or the local governments, responding in order to improve or to somehow respond to the crisis for the most vulnerable populations. No? So I would see from a policy perspective, are governments addressing any specific policies targeting the most vulnerable populations? So for example, many countries and cities have decided to do cash transfers. The cash transfers really reaching and targeting the most vulnerable populations? How are we verifying that? Are these resources really reaching those that are at risk? And of course, from our perspective, if we're doing like some kind of policy to target these vulnerable populations, we should always see which families have young children under 5, because there's a difference between having children that are older than 5 years old and younger than 5. So I think it's interesting to see, are policies addressing these very specific needs of families who have young children? The second thing I would see when reporting is, are families and our population in general able to access basic services such as I was mentioning, health? And if there's any kind of gap, I think it's the responsibility of reporters to start talking about that, and just like telling some stories. I wonder how many people, and how many of you who are currently reporting, how many of you have actually reported on, are young children going to be able to cover their vaccination schemes in this next few months? And this might not seem that relevant in the given context, but it definitely is, because if we do not cover these vaccination schemes, what's going to happen is that we're going to have a different pandemic in a couple of months. And putting the very young in a very vulnerable situation. So I would be very aware of just trying to cover this kind of story. And of course, a different kind of story that has to do with human mobility and what's happening to refugees and migrants. I think there are lots of stories there that we could just like kind of see how are governments addressing this population, which many times does not really have access to any of the like social services systems, because this in most countries, right? If these people are not do not have like a legal status of living there, they cannot really access any of this benefits. So I think this is an interesting area to cover stories and to just like do more reporting on.
And related to that, the Bernard Van Leer Foundation has itself come up with, I think, a very useful set of benchmarks for local governments and local agencies. Could you hit a few of those top level recommendations just so that they're right on the table? And I'll ask Ariel to put into the chat the link to the whole list. But they're actually very helpful in this. Some investments and other recommendations that you recommend.
Yeah, so we've been working lately because, of course, we work and we've been working with early childhood development for 50 years and over 50 years in many different countries around the world. And for us, the most important thing at the moment is ensuring that we can promote like fast solutions that can reach as many families as possible. And some of the main recommendations, and it might be sound repetitive from what I've started saying, but it's just making sure, for example, with governments, are governments prioritizing health and nutrition services? Are they really doing this? Are we really making sure that we're not just like stressing all the efforts from the health sector towards the COVID crisis? Are we seeing all the other basic services that have to do with pregnancy controls, that have to do with vaccination, that have to do with newborn babies controls, and just kind of ensuring this is a very basic thing from a policy perspective. The other thing I think it's very important in this time is to continue to support parent coaching programs. And we have very good parent coaching programs around the world. I can share with you many different examples. But basically, when we're talking about parent coaching is how are we supporting parents to deliver this positive interactions with their young kids? And of course, we've seen a lot of what's happening in the educational services, but we're talking about older children. We are talking about the very young ones, about babies and what's happening in the 3 first years of life, which is sometimes more challenging. And when we're talking about parent coaching and asking governments to support this, we're basically telling them, make sure that caregivers are being taken care of. Because if caregivers are not sound to do like a good parent coaching, this might be very negative in the development of these children in the future. The other thing that we are recommending and strongly recommending is that we can really support mental health services. So we believe that the lockdown, and depending on where we're living, as I was telling you, I'm currently in Quito, which is my home city, and the lockdown here is pretty severe. So we have a curfew, so at 2 o'clock in the afternoon, everybody has to be back in their houses and stay home. Of course, many families cannot stay home because they need to work and they need to bring food to their households. But I think what's interesting about this is that from a mental health perspective, we see that there's some challenges of doing and practicing a positive parenting. And I think one of the things that we're really recommending governments to make sure is that they can invest in preventing and addressing domestic violence, because we do think that this kind of pandemic is raising the levels of violence. So, and here it's really interesting to see that there are some countries that have, there are some countries that lock down everything. So basically you didn't even have access to the justice system. But there are some countries that have purposely opened this justice services so people can still denounce any type of violence.
What are a few of the countries that you think have done a great job on that?
Well, I know 2 examples. It's Colombia and Argentina. So basically, they decided to open the justice services. So if you think about most countries, so I'm thinking about Italy, Spain, and some of the countries that had the biggest problems. They did not consider justice services as some of the main services to remain open.
Yep.
But countries like Argentina and Colombia have decided to consider this as basic services, which is quite interesting.
Yeah.
But again, there are other countries like Spain and I think China. What they've done is that they developed different ways that people could still denounce violence. So I think in Spain, you could do it in a pharmacy, for example. So I think that's quite interesting, but it's just having in top of your mind from a policy perspective that the lockdown, and especially in very vulnerable households, but not only, is really increasing the levels of violence. So how are we reacting to that? What are the kind of services that we can support in order to do that? And finally, but not least, Bruce, I think that this whole lockdown is raising the question of what are we going to do with childcare, right? Like everybody's like, now that we're starting to reopen schools, everybody's talking about, so what about childcare? How are we going to deal with that? And I think it's quite interesting because I cannot think of any other time in history where families have valued childcare as much as this time.
Yeah.
Because they realize how much you can struggle if you want to continue working, if you want to do everything all the house activities plus like parenting in a positive way is
and I think it's easy to forget that there's a history to this, that was a global fight for childcare that in part grew out of global feminism in the 1970s and 1980s, that the integration of women into the workforce in part brought about a revolution in childcare around the world. And now suddenly that's all at risk in a particular way. Let me ask you something else. And by the way, folks, we will go to questions in a minute, so start throwing them into the chat, as a couple folks already have, but please do. But let me ask you something else. Something that came up when you and I spoke in preparation for this session. In a lot of cities around the world, and probably other places too, but certainly in cities, there have been some big changes in response to COVID-19. Taking cars off of certain streets, creating new cycle zones, creating pedestrian zones. Some of those are really quite child friendly. And there have been some other innovations that relate to advocacy that Bernard van Leer and other advocates for early childhood development have done about how human communities can be constructed to the benefit of children. Are there any changes that we have seen that you think should be made a little more permanent, institutionalized, reflected on for their benefit to young children and families going forward?
So yes, so Bruce, you're bringing a very interesting topic, because part of the work that we do is we work at cities, just making sure that cities can be better cities for young children to grow and to connect. But what we're seeing with the whole COVID-19 crisis is that this also brings an opportunity to rethink the way that we develop urban planning in our cities, but also the way that, for example, we move around our cities. So I think there's a huge opportunity around mobility, and this might be something really interesting to start reporting on.
Yeah.
And for me, the mobility starts from really seeing what can we do at a street level, and this has to do with some of the ideas that you just shared of, is there anything innovative about the way that we can use streets, right? Like I think one of the things that this whole crisis has raised is that not everybody has access, for example, to green spaces, right? Like there's a huge gap in cities on how families can easily reach green spaces. And of course, this gap is bigger in the most vulnerable areas of any city, because usually in the most vulnerable areas, you have less access to green infrastructure. But what we've seen is an easy solution is to think and rethink the use of streets, because streets do represent the largest public space that we have in all cities. And in most cities, it can represent like 80% of the space that we have is our streets. But usually we're giving streets to cars. So is there any opportunity with this whole COVID-19 crisis that we can recuperate this public space for people? And we can make sure that now that we're reopening cities, because this is happening, right? Like it's pretty safe to keep people safe at home and to lock down people, but this can only be sustainable for a couple of months. And we're seeing that already, right? So now that we're reopening cities, what are we gonna do? Are we gonna start like moving massively around the cities? Or are we gonna find new ways to move around the cities ensuring that families and people can keep healthy.
I think there are a lot of rich reporting ideas in there. I can imagine a community reporter, a national politics reporter, all focusing on those those kinds of policy questions because they range from the neighborhood level up to national policy. It's a really rich area. Here's a kind of a version of a question in the chat. As we've seen governments and bodies like the EU around the world respond with economic stimulus and so on to the big economic disruption. Are you aware of any governments or global agencies that have included major streams of funding for childcare or other early childhood programs in these first waves of pandemic funding?
I think that in general, there's a lot of advocacy at the moment in many different countries, even I mean, we are based in the Netherlands and we work in the Netherlands. And one of the strong things that people in the Netherlands are starting to advocate for is to universal paid childcare. And this is quite interesting, again, because I think there's the awareness to start doing this, but on the other hand, I think that depending on the context and the country, there's so many needs at the moment that it's kind of difficult to reassure that we're going to get like larger funding for our childcare programs.
Yeah.
For me, the most important thing is to really make sure that we're not going to be regressive on the kind of policies that we might be taking at the moment, right? Like I was talking to my colleague, Claudia from Brazil this morning. We were listening on how bad the whole crisis is hitting Brazil. But of course, so the first thing that this brings to your mind is we need to make sure that we don't have any regressive policies in Brazil, that we can ensure health services for all children, that we can ensure food programs, because there's the raising problems on hunger are going to be there, and there's going to be like a problem with food security. So that's going to be like a main priority. But at the same time, we need to find different innovative solutions that can allow us to reactivate like our economies, reactivate different possibilities for families and households to get back to just like developing a more sustainable life. So yes, I don't know of any concrete example of countries that have increased their funding on childcare, but I do know, for example, Bangladesh, which is quite exciting. They did consider like open all the clinics for pregnant women, and they even like put like more workforce into the system. So this was quite interesting, right? Like they immediately saw there was going to be a risk there of increasing maternal mortality or infant mortality. So what they did in order to avoid that is they strengthened that part of the system in order to make sure that they could curate the system pretty well while they were coping with the whole stress of the crisis as well. Or, for example, the Netherlands is doing a great job on working with midwives and just making sure that they can continue to do their work, even if this means doing a lot of the work remotely. So it's also quite interesting to see that they're doing prenatal visits online. And these are some of the practical solutions that some countries are coming up with.
And again, folks, throw your reporting questions or any other questions for that matter into the chat. I want to return for a minute to this question of migrants and refugees, which you and I have talked a lot about over the years. Whether it's on the Colombia-Venezuela border or the US-Mexico border or the question of Syria refugees or Rohingya, this is obviously a critical time. We've been talking sort of optimistically a little bit, but let me ask you to be a pessimist for a minute. What are you most worried about? What do you see as the real dangers to migrant and refugee children and families in the current situation?
I mean, the real danger is survival, right? Like I really think that this population is in such a vulnerable situation that they're really at the risk of dying.
Yeah.
Um, and, uh, and for us, it's actually, it's quite impressive to see that this might not be the priority in the agenda of many countries and cities, just because, of course, the fact that we have to cope with this whole crisis doesn't, of course, you want to make sure that you're first attending all the local needs. But I think it's quite urgent to start seeing this. And I think the other big stress that I see is that we start to see all these xenophobic reactions, right? Because I mean, local people are already struggling with like keeping like an economic income or finding some kind of job that allows them to survive. So why would they prioritize this job for somebody who's not from that very specific geography? So I think that the xenophobia that this whole thing is creating is also quite it's a big danger. And you can see that there are some countries that are starting to raise these questions of, you know, I told you we should have closed the borders and not let anyone in because now we have like one additional problem. And you start seeing this kind of reactions on what are some of the challenges that this different nationalistic governments might be looking at, like the migration as a problem instead of an opportunity, where I think there's always like a way of seeing a human mobility as an opportunity in any scenario. But I think that now the whole crisis is probably strengthening this negative way of seeing migration or human mobility in general.
Bernard Van Leer Foundation and other funders and NGOs that work on early childhood issues have actually, you guys have done a lot of work in refugee camps over the last few years. You have many partners in that space. What are the organizations that you work with doing to protect not only the populations of these camps in general, but particularly pay attention to the needs of families and small children right now?
Yeah, so we've been working a lot, especially in Jordan, which is a very interesting scenario because I do think that Jordanian government has really welcomed refugees and Syrian refugees in many different ways and just try to be as inclusive as possible. But of course, on the kind of work that we do, we've been working very strongly with different international organizations like IRC, and Comic Relief and some other stakeholders, which I think have a key role on the work that we do. So what they're doing at the moment is, of course, the first thing they've been doing at this time is like making sure that this virus does not spread in the camps. And if you see, I don't think there's been a lot of reporting of what's happening in the refugee camps. And this is a very sensitive area of work because also sometimes it's difficult to report on what's happening on the refugee camps because you don't have all the permits to go in and report and just cover different stories. But I think there are different realities depending on the different camps. But again, this is a very important target group to cover stories because I think
yes,
if this is affecting all of us, imagine how much this is affecting people living in a refugee.
And a brief ad, we do have on the Dart Center website a rich library of resources on covering migrants and refugees, including resources drawing on the experience of journalists in Jordan and elsewhere in the Middle East through one of the programs that Bernard Van Leer has been kind enough to fund over time.
But I've seen, just to share some examples, because I was reading some news this morning, actually, there's some great examples of like very local solutions of what people are doing. So I saw Civic, which is one of our partners in Jordan, for example, they've been delivering this like early childhood packages to caregivers, which basically has like homemade toys and like different like interactive ways of playing. And I thought this was a very nice idea. There's been a lot of support on mental health issues, which I think it's very important because I don't, this is probably another area I would really like prioritize. What are different policies and programs and just like, are governments investing any resources in mental health? You know, because usually mental health is the lowest part of the health budgets in any country. But given the current context, if we don't understand that this is a very difficult time for humanity, but a very difficult time for households that have double, triple vulnerabilities, I think this needs to focus a lot of attention on, do we have any kind of programs related to mental health?
And what does effective mental health pitched toward families and young children, in particular, the youngest children in particular, look like? I mean, if reporters are looking to see if there are these investments being made, what are some of the things to look at?
For me, it's taking care of the caregivers. So for caring for those who care, right? Like, and this does not only apply for caregivers of like parents that have like the direct responsibility of taking care of their children, but also just thinking that many times the caring activities might be with the grandparents, or and now that you're thinking in this whole COVID context, I think, for example, for me, one of the most important ways of ensuring like well-being of the community is also taking care of the frontline workers. Because if you think about frontline workers in the health system, in the social inclusion systems of our countries, they are dealing with a lot of stress. So if we don't start taking care of them, it's quite difficult to start taking care of a broader community.
Yeah.
But for me, it's just having this clarity that the only way that we can ensure like positive parenting is if we take good care of caregivers. If caregivers are in a good, healthy mental health state, they're going to do a good work, even in the worst context. Even if you have like a war outside your house, if your mental state is positive, this will have a positive effect in the well-being of a baby.
But one of the challenges that journalists face covering early childhood in general, but I think particularly at this time, is, as someone writes in this, Ariel writes in the chat, that early childhood programs are typically spread across so many different sectors, education, health, who knows what else. If someone's really trying to get a handle, let's say at the local level or at a regional level, on early childhood right now or in general, what are the best couple of places to start digging, or the couple of real inflection points where you can begin to cultivate sources, begin to see whether things are going well or badly?
I mean, if you start thinking about the child protection, and that's why it's so interesting when you think about early childhood development, you're thinking about you're thinking across sectors, right? So when a child is born, you of course you got to make sure that this child has access to health services. But depending on the household that this child is born, you got to make sure that this family and the household that's supporting this baby, it's also able to cope with the well-being of this baby, right? So I think that what it's important to see is you first need to cover the basic needs of a baby, which are usually related to health services. You then need to see the immediate context that this baby is being raised in, and see that the household is supported, either with psychological support, economic support, food support, employment support. There are different ways of supporting a household. And then, of course, I think, as I was saying before, it's always important to see the nutrition factors of what's happening with this baby, and of course, the learning and the educational stimulation that you can give to this household and family in order to ensure this holistic approach of integrating all the different services, right?
Yeah. Stefania Corpi is asking a really, I think, important question. We've been focusing, and in general, and somewhat in this conversation, on health and the economy. But what are the less visible long-term effects on children? If this period of isolation from childcare, of not particularly well-supported homeschooling goes on, if there's persistent increases in family violence, what are we looking at 5, 10, a generation from now? What are the long-term consequences of not addressing these issues?
I think, I mean, from an epidemiological point of view, I think that the big concern is that we might have like a regressive statistics on what's going to happen in social indicators such as maternal mortality, infant mortality, and of course this affects like the whole well-being of families.
Mhm.
I think from a development perspective, and this is quite interesting because I've heard many people being concerned of how can we promote like early or like daycare remote programs, like, and actually in many places they're having like remote lessons for very young children. Uh, this is quite interesting because we don't really know what this is going to generate, but from my perspective, what very young children need is like real social connections. So I'm not sure that having any kind of connections remotely for very young children will have a positive effect. But I wouldn't dare to say that we know what would be the effect. I personally believe that very young children, because of all the evidence that we have of how like positive interactions between caregivers and young children, between siblings and young children, between people surrounding the immediate context of children, really promoting this positive reactions and connections is what we need to do in the very early stages of life. I don't really think this can happen remotely. So
Mm.
I would suggest families, you know, whenever I talk to a friend of mine who's concerned about like their 3-year-old child not being able to access to a daycare remotely, I tell her that's better. Just let them play. Just let them imagine new things. Give them space and time to connect with nature, to connect with their immediate surrounding them. I think one of the effects, and there's some research going on right now, is the lockdown is also creating all these fears because in the very early stages of life, children develop this sense of security and identity. And part of this identity is given because of the kind of relations they have with other people, with the city, with different situations. But if they're in a constant lockdown, this interactions are limited to very limited interactions. So there will be an effect on development as well. I mean, they might be making less connections
Mm.
just because they're not as stimulated as they used
So
to be.
fewer neural connections, which is going to have
Yes.
long-term psychological, educational, and life course outcomes. And that in turn, and we've got just a couple minutes left, that suggests that while we've been focusing to the extent that discussion has focused on children at all, it's been, well, in the pandemic, we've got to take care of kids, or how do we homeschool? But what you're suggesting is that young children need to be prioritized in reopening strategies. That there's got to be some prioritization and consideration for the significance of getting children back in touch with one another in a safe way. Um, have you seen any local or national efforts around the world that are um, trying to sort out social distancing and child engagement at the same time?
Yes, and this is related to one of the ideas I was sharing before. There are many cities that are, for example, opening streets for play.
Mhm.
And this, again, because basically what's happening is if you don't have access to any public space because you live in one of the slums in Brazil or in one of the slums in India, I mean, how are you thinking? I mean, it's even more stressful to stay in-house than to actually have like an open space to interact with others. So there's some things happening, not in these two countries that I mentioned, but I know that, for example, the Netherlands, Israel, even in Lima in Peru, we've heard about like some initial thoughts of how to map some streets in the city that could become pedestrian streets, so it's safer to play on the streets,
Mhm.
it's safer to bike on the streets, and it's like reopening this immediate public space that's close to everyone. Um, I think there are bigger challenges there because, of course, once that you start thinking about reopening cities, you're thinking about uh, the immediate reopening, which is like the immediate street. But then if you start reopening activities, you also got to think about how people are going to move from one place to another.
Yeah.
And there are big challenges there because of the gaps that we might have. But from a child's perspective, having this access to an immediate open space, we believe this is a very important thing to start seeing and thinking of. I don't think we're thinking about, I haven't even seen, you know, in all the news or articles I'm reading, we don't necessarily see a lot about what's happening with babies. We do see a lot of what's happening to children, but not necessarily to the very young, babies and toddlers.
And that, I think, is as good a place to wind up as any. There are many more questions in the chat, but we are pledged to a 45-minute webinar here. And certainly folks can be in touch with Cecilia Vaca Jones. We'll share your contact information if that's okay with everyone who registered for this session. So thank you very much. If we could quickly, if you could all turn your cameras on and do a wave of thank you to Cece, and perhaps somebody can, one of the team can do a screenshot of this for the records. Thank you. Applause for our wonderful guest.
Thank
Cameras
you,
on,
Bruce.
folks. Cameras on.
And happy to cover any questions that you might have for the future.
And again, I want to thank Susan Kaplan, who is preparing our running tip sheet, which is on the Dart Center website, and we will be producing other resources as part of this project. I want to thank Kate Black and Ariel Richen, who have been producing this on the Dart Center end. And all of you for coming, staying. A number of you have been coming back to these time and time again. I hope they're rich conversations. Looking forward. And this coming Friday, our next conversation will be also about covering children with a reporter, John Woodrow Cox of the Washington Post, who has done remarkable reporting of the impact of violence and trauma on very young children. Looking forward to that. Thank you all.